Hello, welcome to another exciting Pelicast. My name is Eric Peterson. I am the director of the Pelican Center for Technology and Innovation. Session is here. It's a very exciting time in Louisiana. We got a lot of good bills coming down. The legislative session, which is only 2 months this year, so it is definitely a sprint, not a marathon. Today, we are joined by two great guests, two lawmakers who are running some great bills on technology and innovation. We've got Representative Tanner Magee and Representative Bob Owen. How are you guys doing today?
Hey, how's
Doing
it going?
great. Thanks for having us.
Yeah, we are excited to have you both too. Tanner, it's an exciting day for us at the Pelican Institute. We have just released our newest healthcare paper called Medicine in a Digital Age. It is all about telehealth and how we can expand that in Louisiana. And coincidentally, you are running a telehealth bill in Louisiana. I'm sure many of the people watching the stream today might have engaged in telehealth during the pandemic. There was a huge spike in its usage as people wanted to stay home and keep themselves safe. So what made you brought the bill? What is sort of the problem in Louisiana that you felt needed to be fixed?
Well, I'm in my second term, but when I got elected my first term, we had a lot of older legislators who probably weren't interested in revamping Louisiana's kind of economy and service around the internet. So I started filing bills back then. I mean, I was involved in Uber. I was involved in trying to get clerks online. I mean, there's a bunch of different efforts I was making. I also started my legislative career on health and welfare when they had a telemedicine bill back then, and it really got kind of passed, but it didn't really do much because it really didn't open it up enough. And so it's been something that I've thought about for a while, and having conversations with the doctors have always been against it. Is really what's been kind of the problem. But having conversations with some of my friends who are in the medical field as doctors, I think the COVID was a great change because you hate to say COVID was a great change, but I think it's one of those crises that allows for opportunity. And I think doctors got used to doing online or app-based, however you want to call it, delivery models because they had to. And I think it kind of changed the perception of what they thought it could be. And I think maybe for a lot of them, they didn't see it as a competition, but as a way to make their practices more efficient. And I thought, well, this is the time, if we're going to do it, this is the time to do it right now because it's not going to get easier to do these kind of things. I think the old slogan of never let a good crisis go to waste is probably really applicable at this. So that's really the genesis of it. So I thought it was a new way that I could get Louisiana moving in a more more open society that we desperately need, not just in medicine, but across the board.
Yeah, I always love a good Rahm Emanuel quote when we're starting a Pelicast. That's good stuff. And for those of you who missed the sort of Uber fight, there was a big fight between traditional taxis and sort of the gig economy. Louisiana, one of the last states to actually get a rideshare model done. So thank you so much for doing that. But I think you really highlighted how much the pandemic has changed our relationship with technology. If I said we were to be having this chat sort of online right now, people would have looked at us a little strange, and now people really don't think twice about it. Everyone sort of got used to Zoom or Microsoft Teams or whatever. So it's great to hear that doctors are embracing it. Tell us a little bit, you have an interesting research. What is kind of the healthcare delivery there? Do you have a big hospital? How easy is it for people to get care and see the specialists that they need?
Well, one of the issues we have in Louisiana is rural healthcare across the board. When you have a state that has a significant part of the state rural, getting doctors to live in rural communities is difficult for obvious reasons. And I think this bill is a way that we can get doctors out to rural patients who need that because they don't have to do the traveling. You have some pretty remote people in the state of Louisiana. And I think, and part of the issue is access to internet as well, but that's another discussion that other people are involved in. But once we get the access available, it's a way to bring the healthcare. And look, we fought, and you have to fight again this session, nurse practitioners versus doctors, because you have a lot of nurse practitioners out in the rural communities, and they're supposed to have a doctor supervising them, but the doctors don't often really supervise them because of the distance of travel. And the great thing about the internet is it solves that problem. So if we want to improve our healthcare outcomes, which we're 49th or 50th in most of these rankings, and part of it is getting these rural people who have less access, people who are in poverty, don't have transportation. The internet is a great way for us to bridge that divide and really get healthcare and start improving healthcare outcomes.
Yeah, again, if you check out our paper, we note that 5 or 4 urban parishes have more than 35 physicians per 10,000 residents. There are 15 parishes in the state of Louisiana that have less than 5 per 10,000 residents. So when we talk about sort of that disparity there in food, and even if you have a physician, you might not be able to get them. Tell us a little bit about like your ability to go see a specialist, right? Why is telehealth so important to sort of get out of just being like your general practitioner, which most of us do?
Yeah, and then the other thing too is getting specialists. And look, I'm gonna take it off so weird. You brought up specialists, but there's a lot of things we learned talking to doctors that people are a little bit afraid to go bring it to their local GP that they know. I
Interesting.
mean, I hate to be, yeah, like erectile dysfunction. Nobody wants to go to Mark, their friend, who's also their general practitioner, and talk
Yeah.
about erectile dysfunction. So they would feel more comfortable actually getting on the internet and talking to a doctor they're probably not going to see very often, or they won't see at the grocery store to talk about issues like that. I know that's not the question you asked, really, but I mean, I think it's something that I think is really interesting that people have conditions that they're a little bit embarrassed about, and they're a little bit
Mhm.
embarrassed to go to somebody they see on a regular basis or who maybe they know in a social circle, which I know is not what all. I think the question was more geared towards how
No,
difficult it is getting specialists, but we've learned that actually by talking to people and talking to providers that during COVID you saw an expansion of this too. That people, the biggest growing market was erectile dysfunction on these services because they learned that they could get on these things that were available to them, and they could have contact somebody they wouldn't see, and they felt more open. It's kind of like going, to a priest out of. I joke that it's like going to confession out of town, but
there you go.
yeah, I think there's that feeling and sense that we can also bring in a good specialist that you may not have in your area to provide the health care because specialists are so rare and are not available. But on the flip side, on the patient side of it, I think is that they may be more comfortable going out and getting that specialist, knowing that the specialist is going to be really somebody they'll never see again, other than through the web-based thing. And then you also have the issue of like people would, they want to get checkups or not second opinions from doctors
Mhm.
outside of their area because they think maybe MD Anderson has a better world-renowned specialist on this area, and it gives us an opportunity to create treatment plans more seamlessly from MD Anderson down to your local provider in the state. I mean, everything can kind of flow more efficiently with telemedicine.
Yeah, I think you bring up a really important point. People have kind of gotten used to this method of delivery. They feel more comfortable using it. And there are a lot of great companies out there making telehealth more acceptable or accessible just outside of your kind of traditional doctor. Or companies springing up around telehealth, and it's important to have our laws right to kind of encourage kind of innovation and hopefully bring more doctors in the state, but more importantly, get more access for the people of Louisiana. Representative Owen, I want to talk a little bit about access with you. You've got a really exciting bill that we've been talking a lot about at the Pelican Institute, aerial drones. We've seen some great confluence actually with the medical industry and the drone industry. We've seen testing kits brought in Texas. We've seen pharmacies brought down in Florida. What do you think the future of the drone industry is in Louisiana?
So drone technology is really come around. I mean, obviously, in the past few years, it's really kind of amazing. It's gone from basically being a toy to being something that's used in agriculture. It's used in land surveying. It's used in offshore oil rigs, in deliveries. There's all these things that it's come to been used in military uses, and it's one of those industries where it is regulated right now, by the FAA, but it
Mhm.
also has state regulations as well. So when I looked into this, we basically the state, we're ranked around 34th in terms of our laws and regulations, which once again, I don't like to be down at the bottom of the list, in Louisiana again. For I'd like to be up at the top. So, we with my legislation basically would do is put us up in the top 5 of states in terms of our ranking in terms of the drone legislation. So what my bill is going to do is it's going to clarify where drones can fly.
Yeah.
Without the risk of like frivolous lawsuits, because that is an issue, So like if you
Absolutely.
that is, so people are concerned about drones flying over people's houses and things along those lines. So it's gonna clarify a little bit of that, those legal aspect, but it also protects the citizens and the property at the same time.
Yeah.
It's going to allow the state to, like in the cities, to create drone highways essentially, so that you have delivery points where you can go from point A to point B, and actually like be able to deliver things like medications and groceries if you wanted to, or whatever it might be. So you have that aspect of it, which is which benefits the state and the local governments. And then also we're going to establish a drone task force to basically try to just keep an eye on future innovations that come along that might pop up in the future, where things that we don't actually know about, that that might just all of a sudden come up down the road, that we can continually monitor and keep an eye on. So
Yeah, I mean, that all sounds great. When you kind of get in the details there, lack of regulatory clarity is something that we hear all the time from entrepreneurs. I don't know that I can kind of be in the state of Louisiana and grow my business because I don't understand the law, or I'm afraid of lawsuits. Something we dealt with a lot last session when it came to court reform. I want to talk just a little bit about the task force, and why you wanted to set it up, and how you think that kind of goes into the future of Louisiana as being an innovative state, a state that embraces innovation, is always looking at to be at the edge rather than, like you said, kind of down at the bottom.
I'm sorry. Ask me that one more time. I didn't hear you on that.
Yeah, just talk a little bit about why you think this bill is important, so Louisiana is kind of on the forefront of innovation rather than kind of behind the 8 ball like we've done too often.
Sure. So, it's basically, we're looking to innovate here in Louisiana, and one of the reasons I started, in this job is because I'm tired of people leaving the state.
Yeah.
I mean, that's the bottom line. I don't want our kids to, come here, get a great education, and leave and go to Texas or Georgia or Florida or somewhere else. I mean, this is one of these, areas where we actually can create jobs here. We have Amazon, building a distribution center in Slidell. We have another one in Baton Rouge, and this is just at the right time in the right place. Creating these avenues where we have the technology, and we have the services and the industry coming in all at the same time. It's just the right time and the right place to have something like this coming in.
Yeah, Tanner, I kind of want to throw the same question to you. You talked a little bit about when you came in, trying to convince legislators that embracing innovation, embracing the internet, embracing these technologies were possible. What do you think have been the biggest roadblocks to sort of getting these bills passed? And what do you see for like the future of innovation in Louisiana? We talked a lot about some of the bills we've seen here, but kind of give us a more holistic picture.
I think one of the biggest road obstacles that we got over is, I also talk about the good things about term limits and the bad things about term limits. There's definitely disadvantages, but one of the advantages is the legislature itself has gotten younger since I've gotten there.
Mm-hmm.
Representatives like Bob have come in, and they get it more. I mean, at the end of the day,
Yeah.
They're more comfortable with it. They grew up with it. For a lot of the past legislators, it's just something they had to adapt to, not something that they really grew up with. And I think for us, we know that this is the future, that you got to keep up with the times. It's growing. We got to do everything we can to embrace it. That's how our economy is going to grow. And I don't think there's a way of explaining that to the generation that just left the legislature. So I think really we cleared a lot of roadblocks. I think the one thing we still have available, or one of the traditional things, is a lot of these association groups are maybe a little bit behind their members, meaning like the doctors have an association with the lobbyists. I think a lot of doctors have moved on telehealth after COVID. Now, will their association follow what their membership is doing is kind of the bigger question, I think. And I think they will, but I think there's going to be a little bit of a lag time as they go through their structures. But we'll see. That's kind of the question of the session, I think, on some of these associations.
Yeah, we're certainly seeing a lot of bills dealing with innovation. We've had Mark right on to talk about sandboxes. We've got some great stuff with broadband, and of course, your two bills. Representative Owen, how do you go and sort of sell your district on these sort of innovation policies? Tanner kind of gave us a great question about what's going on under the dome. But of course, politicians respond to the voters. So how do you get people in Louisiana more excited about legislators who embrace these sort of new technologies and want to make Louisiana an innovative place?
So I really think that, I mean, of course, I come from St. Tammany, which is a very business friendly, parish, but I really think jobs are always key. That's the bottom line is these are, innovation creates jobs, and that's I think pushing that message always just is the bottom line. And as long as you do that and you push that message home, it's a simple message, but it's effective, and I really think that is the key, honestly.
Yeah, right. We look at our neighboring Texas, we're getting companies like Tesla and Oracle moving right next door. I see no reason why they don't set up shop in Louisiana. I know we're doing some great work on taxes this session, which I won't get into. Kind of that pro-innovation policies along with the pro-growth tax code can really make a difference. I want to sort of finish up with you, Tanner. You are a prolific tweeter. You sent out a great picture yesterday of kind of the command and control console up in the house. So tell us a little bit first about what is that command and control console does. It looks very cool. And then two, why you think kind of being online and being accessible to residents on Twitter is so important.
Yeah, no, I appreciate it. I'm a user of social media. I follow a bunch of other politicians, and I find that their accounts are very sort of like traditional staid. They obviously have some kind of communications guy drafting these very like almost message tested statements all the time. And it just seems so out of touch with reality, but I'm sure who those people actually are. I think what social media people want and what the constituents want is to get to know you a little bit, right? And know that you're an actual human being and not some like political bot. And I try to put as much of my actual personality out there, which I sometimes can rub people the wrong way, I'm sure, but I think it's great that people see who the real person is, have them respond. If you ask a question, I try to answer it. I mean, you got to kind of do within reason because you can create an endless flame war thread, and I've probably gone on the wrong side of that line before. My wife likes to tell me about, please stop tweeting. But then, also, like yesterday or the day before when I put the command and control, most legislators don't get to see what's behind the speaker's rostrum of how he's running the actual chamber. It looks like he's just kind of standing up there doing nothing as far as the actual things. He's just a lot of standing, looking out and saying words in the microphone. But there's a whole system back there that I just got to learn as being Speaker Pro Tem that I didn't know last term. And I thought it'd be great if the public got to see what's really going on. I think a lot of times the public doesn't realize how much work is going into what we're doing on a daily basis. And not just from the bills, but just the mechanics of it. And, you were talking about this technology, and while you're talking about it, Eric, something came to mind. Like, we are still a paper-based legislature. And Bob can tell you this. Our desks are full of paper. They put all the bills, paper. I mean, I grab the paper. It's available in there too, and I put it in the trash can. And literally, they give it to me. I just do this all day long because I'm keeping up with my iPad with this stuff. But for a lot of legislators themselves, which I think shows you the divide, they don't want to do it that way. They want reams and reams of paper on the desk because that's what they're comfortable with. And I mean, it's you can rebuild a rainforest with the paper the legislature uses on a daily basis. But and that's manual labor. We employ workers to do all that stuff, where we could be more efficient. And from a technological sense, I think once you got enough. Go ahead, Bob.
Yeah, I just want to tell you, I weighed the amount of paper we brought home the other day. It was a little over 2 pounds.
Wow. Look at that.
Yeah. And I mean, and just think about what we could do with those resources. Other things we could do if we weren't worried about putting paper on everybody's desk on a minute by minute basis. I mean, amendments come out by paper. I mean, this term we changed in the House where we don't send out amendments anymore by paper. That's new this year or last year. Last term, every amendment had to be passed out across the body. Now we just say it's available online. So we're trying to get away from it, and it's moving as fast as we can. But with the legislators we have, we can't do anything they're uncomfortable with at this point. So I mean, I think that's, kind of. I know this is a longer question than what you asked.
Yeah.
But I think it's important for people to understand. And that's why I try to show as much as I can of it on Twitter itself, so people get a good behind the scenes look.
No, I think that's great. Absolutely. I'll kind of end with you, Representative Owen. What's sort of a tech fix that you would like to see? I know you're a pretty new state rep. Something that you think could use some updating in the state of Louisiana. Maybe get some of that streamlining and use text well, like Tanner was talking about.
Well, streamlining for the legislature or for just in general.
Either one. Go ahead.
So, I think Louisiana in general needs, in terms of, I come from a medical background.
Mm-hmm.
I'd love to see Louisiana really kind of update their some of the medical innovations that some of the other states have taken on, especially with prescriptions. There's a lot of things that get bogged down in the system. In terms of it's more bureaucracy than anything else, but it is technology based, and so I think that we can do better there. And it's one of those things that it's a little minor thing, but it affects everybody in a lot of ways. And it's I think that's something that I'm planning on working on going forward. It's a minor thing, but it's a major thing as well. So that's something I plan on looking at down the road.
Well, I love to always hear politicians cut down on bureaucracy and embrace innovation. That's great. Tanner and Representative Owen, we are going to be monitoring your telehealth bills and your drone bills. I'm sure we'll catch up with you in the halls in the Capitol when they get brought up and update everyone out there watching. If you're also out there watching, go online to pelicanpolicy.org and check out our new telehealth paper and our great one-pager. And we will see everyone later. Thank you so much for joining us today.